Hi guys, welcome back. These are your favorite dental girlies, and today we're going to talk about generalized intellectual disorders.
Okay, generalized intellectual disorders involve significant limitations in intellectual functioning as well as adaptive behavior, and these limitations begin before the age of 18. And causes may include genetic conditions such as Down syndrome, prenatal exposure to alcohol or infections, birth complications, and environmental factors.
So there are some classifications of these intellectual disorders, and usually they are classified by IQ. So there's mild, moderate, severe, profound, and then based on their IQ, it gives you a mental age. And then there are some key characteristics for each one. So mild, they might be slower learners, can live semi-independently with support. Moderate, they're going to have some delays in their early years, basic communication only, and they need consistent support. If they're severe category, then they're going to be very limited in their communication. They're going to require more constant support and supervision. And then if they're in the profound category, then they're going to be have more severe mental and physical limitations and require more constant care.
Perfect. Now we're going to talk about typical treatment. So while there's no cure for this, treatment focuses on support and skill building, such as having them go to occupational therapy, behavioral therapy, having support from their families. It's very important to also do early assessments and early interventions for these individuals as well.
Okay, now we're going to talk about common oral findings. So, patients with intellectual disorders may present with high risk for dental caries, periodontal disease, bruxism, drooling, high caries risk, malocclusion, and oral trauma may be observed, especially in those with poor muscle coordination or serious self injuries.
Okay, and then lastly, we have considerations for dental hygiene treatment. So, when treating a patient with intellectual disability, it's important to be patient, use simple instructions, provide clear visual or tactile cues, and then desensitization techniques and shorter appointments may be helpful. Involving caregivers in OHE is really important, and then frequent recare. Address social and environmental factors, cognitive and motor impairment, and then oral tactile sensitivities. And lastly, just reviewing their medications if they're taking any, as it can contribute to xerostomia or gingival overgrowth. And that is it. So thank you for joining us.
Yes, and come back to see your favorite dental girlies.